going to do is go over the skull, and I'm going to be following along the objectives that you have in the syllabus. So if you have your objectives, and perhaps even if you have a skull, then you could follow through with me. I'm going to be pointing out to the bones and the anatomical features on those bones that I'd like you to know in preparation for the lab practical exam on skeleton. So here we have a skull, and starting in with the skull, then I'm dealing with some of the bones. Take some of the easy ones first of all. Forming the cranium, we've got a frontal bone. Now what I'm going to do is I'm going to outline it. So I'm just going to kind of follow the suture lines, even though a lot of the suture lines are not visible, so that we can kind of define the borders of that frontal bone. And as you can see, the way in which I'm following it, the frontal bone dips down in to form part of the superior aspect of the orbits, and even a little bit about the side of the face here, and around the side of the head, and then it comes across the top, like so. So therefore, all this rather large bone that's been quite extensive here, this is all frontal bone. Now, if we go to the side, then another really easy bone to learn of the skull is the parietal bone, which is this one here. Likewise, there's one just like it here on the other side. So tracing the boundaries of the parietal bone, we would find that its boundaries are in this fashion here for the left parietal bone. Okay? Then also, forming the side of the skull is the temporal bone. It's a little bit more convoluted, and so tracing the borders of it on how it's joining with the surrounding bones, we would find that the temporal bone extends around like so, staying up underneath, forming part of the inferior aspect of the skull, around the side, even into this rather large fossa, and back up like so. So all of this bone here is all temporal bone. And even this little bridge that extends out like so, to this point here, when you're examining the skulls, if you look closely, there's a suture right here. And so the temporal bone extends out to there. Now, there are several features on this temporal bone that we'd also need to consider too. For example, this little piece of bone that extends out to this point here is the zygomatic process of the temporal bone. Quite often these terms are named according to the bone that they face upon. For example, this is all zygomatic bone here, so instead of calling this the temporal process of the temporal bone, it's called the zygomatic process of the temporal bone, because that's the part that is going to be facing that zygomatic bone. We find that methodology of the nomenclature being pretty consistent all the way through the skeleton. In addition to that, we've also got this opening, which in life is your auditory canal. Technically, as far as the bony structure of it, it is the external auditory meatus. Also, another very important landmark feature of the temporal bone is this rather large lump here. This is the mastoid process. This can be felt just right behind your earlobe. And then this little spike of a piece of temporal bone is the styloid process, used to attach muscles of your tongue and muscles of your throat. So the styloid process. If you're examining a real skull rather than one of these plastic specimens, more than likely the styloid process has been broken off because it's fairly fragile. Then also, if I take the mandible, whose normal position is like such, and kind of move it out of the way, then there's a depression, a fossa, right here on that temporal bone, the mandibular fossa, called mandibular fossa because that's the articulation with the mandible. Now that articulation forms the only movable joint within the skull, the temporal mandibular joint, a very important joint in dental science. Quite often things wrong with that joint result in quite a variety of dental problems, or vice versa, a variety of dental problems can result in disorders of the temporal mandibular joint also. Okay? Now we're going to move this mandible out of the way so we can have more access to some of the rest of the skull. So looking at the posterior surface of the skull, another rather large bone forming part of the cranial cavity is the occipital bone. Now all this is all occipital bone. But if I trace the boundaries of the occipital bone, it comes down around here just posterior to the mastoid process. And now if I'm looking at the inferior surface of the skull, then I can continue to trace the occipital bone as it extends anteriorly, so that all this portion here is part of the occipital bone forming the floor of the cranial cavity. The occipital bone comes back like so. So all this rather large bone, all in through here, this is all occipital bone. So you can see it forms quite a bit of the boundaries of the cranial cavity. One of its notable features is this great big opening called the foramen magnum for passage of the spinal cord. If you're studying the central nervous system, we'll use this as a landmark to delineate the spinal cord from the brainstem. Brainstem being that part of the brain above this point, and the spinal cord being the portion that is caudal to it. On either side of the foramen magnum, two rather large bumps, occipital condyles, to receive and articulate with the first cervical vertebra, also called the atlas. And with this type of a joint here, then this will allow a forward flexion and extension movement of the head, as if you were making the nodding motion, as if you were saying yes. So this is the occipital bone. Now, all the bones of the skull are joined together or articulate together by a type of immovable joint called a suture. The sutures are these hairline-like, fracture-like types things, only they're not real fractures, they're actually the joints that are formed by the bones. In life, there's always a little bit of connective tissue, fibrous connective tissue that's going to be between those joining bones. All of the sutures throughout the entire skull have names. Some of them I am asking you to learn, and the ones I'm asking to learn are pretty easy and obvious. For example, this rather large suture going across like so to serve as the articulation between the frontal bone anteriorly and the two parietal bones posteriorly is the coronal suture, named so because it's going on a coronal plane. We've got this rather large suture going right down through the midline that would separate the right and the left parietal bone. Thus, this would be the longitudinal fissure. You may also call it a sagittal or mid-sagittal suture. The large suture here at the posterior aspect of the skull that would be separating the parietal bones anteriorly from the occipital bone posteriorly would be the lambdoidal suture. And then the sutures that you would find at the side, both on the left side of the skull, likewise on the other side, that is forming the articulation between the temporal bone and the parietal bone and frontal bone somewhat, are the squamosal sutures. I keep that straight because I think squamosal begin with an S is also on the side of the skull, begin with an S also. All the other sutures you can actually name by deriving the names. Just simply say the two bones are joined together and then say suture, like temporal zygomatic suture. So all those you can really sound technical, but you're really deriving the names. Now, other bone structures of the skull. Let's take a look and see what we can see from an anterior view then. Two very small bones form the bridge of the nose, a pair of nasals. These are the two bones that will probably get easily broken in a fracture of the nose. Then off to the lateral aspect of the nasal bones is a piece of the maxillary bone, which is your upper jaw. And I'm tracing the outline of the maxillary bone. So this bony area in here is maxillary, but then you see most all of the maxillary bone as all this rather extensive bone that is forming the upper jaw that even kind of winds around like so. So as long as I'm on the subject of the maxillary bone, I'm going to trace its entire course. And you can see that that maxillary bone is really quite extensive. It extends around the sides. All the upper teeth are within it. The maxillary bone even forms part of the floor of the nasal cavity, even forming part of the very anterior-most aspect of the nasal septum, septum being a divider or partition. And that maxillary bone extends around like so, suture line, and again a piece of it extending up to be located between the nasal bones and the lacrimal bone that is more posterior. Within this maxillary bone, you've got your upper dentures. One of the terms associated with that maxillary bone is alveolar processes. You don't really see them per se on the specimen, but you would if you were to pull a tooth out and revealing then the socket that the roots fit into. And the sockets that the roots fit into then are the alveolar processes.